Well, we are back. We are live again, and this is Professor Tabs. This time we're talking about pathology, the basics of pathology, and we're going to start off with a definition about pathology. What is pathology? So we're talking about structural and functional changes. Pathology is the study of the essential nature of disease processes. Again, it's the study of the structural and functional changes in organs and tissues that cause or are caused by disease. So when you break up pathology, what does that mean? What does pathos mean? Suffering, what does logos mean? To study. So we are basically studying suffering. Okay, let's start off by asking this question. What are the three main anatomic concepts of disease? Basically, what three areas do all diseases fall into? How would you characterize them? Well, they're either degenerative, inflammatory, or neoplastic. So when we try to understand the concepts of cellular growth adaptations, what are we going to be talking about when we have a cell injury? We're going to talk about this in detail more later, but we're going to talk about the plasias and the trophies. So what are they? Well, we have hyperplasia and metaplasia, and we have hypertrophy and atrophy, so and a few others. So we'll talk about these. We're also going to talk about some of the factors leading to cell injury and death. So what are some of these factors? Can you think of some? Well, that could be oxygen, physical, chemical, infection, immunologic, genetic, nutritional, among others. For example, ischemia. Well, we'll talk about those, but first, before we do that, let's identify some subcellular pathologic mechanisms. Can you name a few? How about ATP, mitochondria, calcium, free radicals, membranes? What happens when the membranes are damaged? And can you differentiate apoptosis from necrosis? What's the difference between apoptosis and necrosis? And we'll also be understanding subcellular responses to injury. For example, lysosomal responses, smooth endoplasmic reticulum responses, responses from the mitochondria and the cytoskeleton. So let's just have a few questions here regarding apoptosis and necrosis. Very basic question. Which one would attract the inflammatory response? Of course, that would be necrosis. At the subcellular level, what would happen if you had raised or increased calcium levels? That would lead to cell death or apoptosis. Okay, let's ask another question here. Can you identify any common intracellular accumulations that can cause pathologies? Well, you could have too much fat, hyaline, calcium, proteins, glycogen, pigment buildups, more than what is usual in a cell. So, for example, you might find fat in other cells where it is normal. For example, in adipose tissue, it's not unusual to find fat. But if you find too much fat in the liver cell, then you're going to have problems. And we will be talking about this and also trying to understand aging and differentiate the concepts of pre-programmed death versus wear and tear. I will be touching on both systemic and general pathology, but as you know, I'm a student here and I'm just basically looking at my lectures, but If you really want to learn about pathology, I recommend you go and join Dr. Minarsik's Global Pathology class, and that's where you're really going to learn pathology. So I recommend you go to his website, and that is medicalschoolpathology.com, and you can see his Global Pathology class, which is free, by the way, a free 9-month course. And also go to YouTube and check out Shotgun Pathology. Excuse me, yeah, Shotgun Histology. Shotgun Histology is another amazing series where it'll take you through about 90 slides and looking in detail at uh, different pathologies, but mostly normal slides uh, of the body with great detail. It's very, very interesting, and I recommend you look at the Global Pathology class. It's really fantastic. You can join for free. So just a quick overview here will be, as I said, we'll be looking at general and systemic pathology, but just a quick overview, we'll be looking at the etiology of the diseases, the causes, genetic or acquired, pathogenesis, the sequence and patterns of cellular injury that lead to the disease, morphology, which is the abnormal anatomy as defined by the gross and microscopic changes, and the clinical expression, the signs and symptoms, the course of the disease, and the prognosis. So talking about morphology, let's think about abnormal anatomy. So we'll be looking at gross, microscopic, and molecular abnormal anatomy. So the question here is, which would be noticed first? And the answer is at the molecular level is where you would notice these things, and that's why we have microscopes. That's why we have the chance to look at the molecular level so we can catch these diseases before they're noticed uh, at the level where you can see them with the human eye. So we're going to try to figure out the typical sequence of events, and we're going to try to see what we can remember and notice here. Anyway, moving on, let's talk about some of the methods. Just as an overview, as for the gross examination of organs, we look at the size, shape, consistency, and color, and microscopically, we use H&E stains, look at slides, hematoxylin, focusing on DNA, and eosin for the cytoplasm. Then we have histochemical stains, acid-fast, Prussian blue, immunohistochemical stains, immunofluorescence, microscopy, transmission electron microscopy, and then molecular techniques to amplify DNA would be PCR or electrophoresis. We talked about that in molecular biology in detail, but we're going to be looking at that again. But this core staining is important because most of the stuff in the body is clear when you look at it without staining.